Yep. The other, my iPhone went 12:59, my iPad went 12:58. Hi, Jordana. We're not ready yet.
And Marky, I think Greg's plan is to be here.
He plans on calling in, so,
Okay.
and I don't know.
As far as I know, Tori's going to be here, but if not, I'm here.
And Jordana, while I've got you, I just want to let you know you're doing an amazing job.
Thanks,
Isn't
Patty.
it?
Really appreciate it. It's not been easy, and you've taken it on really well. We're proud of you.
She's really good stuff. I hope we hire her permanently. Whoops.
I hope she applied.
Oh, there's that one little thing.
Yeah. I don't know. It's been a rough year.
I ditto Patty's remarks.
No, I just wish she could get a good weekend away and spend time with her family. It's one of my dreams, is for all the staff to have a break.
We're sending John Peacock away.
You
We
are?
haven't, we're telling him he's taking 2 weeks off the grid.
You think he'll behave and do that?
He might not behave, but he'll do that. Hopefully he doesn't behave while he's doing that. We want him to go out there and have a good time.
Yes, he needs a break too. Jordana, it looks like we should have quorum. Okay, we do have quorum, so I will go ahead and call the meeting to order. And I want to thank everyone for joining us today. It's so good to see you again. Sky is beautiful and the snow is, well, since I can't ski with my shoulder, I looked at Billy Manson. How's the snow? Is it great? I'm jealous. Do I have any additions to the agenda for today?
Just an update that Carlin's going to be doing the vaccination update instead of me.
Okay, that's wonderful news. So that's great. So we don't have any additions to the agenda, just that slight change. And I'll see if there's any changes to the minutes of the last meeting. If not, I'll ask for a motion to approve.
I so move.
Thank you very much, Tom. Do I have a second? Thank Brent. All in support, raise your right hand. Okay, let's move on. In terms of today's agenda, and I'll turn it over to Josh. I think that's our next item on, and that is in the data update.
Great, thanks, Marky. Okay, so just wanted to start off kind of documenting and looking at where things are at across the US. There's a lot of optimism and good news out there, especially around the vaccines. But do always want to, put out a word of caution, just as we're looking toward what the next few months may look like. So you'll notice here, this is daily new confirmed COVID-19 cases throughout the US since the pandemic started. And so we have had a very sharp decline in cases across the country since about mid-January. But in the last 4 or 5 days or so, we've had a pretty significant leveling off. So whereas we were seeing cases drop each day, we have begun to see cases starting to level off a bit. Dr. Rochelle Walensky, the new CDC appointed director, quoted the other day that she's worried that the proliferation of these COVID-19 variants may begin or may have the potential to reverse the progress that has been made to control the pandemic. And she's not necessarily referring only to what's going on here locally in the US, she's referring to globally. Because if the virus continues to mutate globally, it'll eventually make its way back here and could end up sort of setting us back a little bit. So she has some concern about these new variants and where they might take us. And the data is potentially showing a little bit of that shift in these variant cases more recently. Next slide. And then also, deaths have been decreasing as well, but over the last few days, we have seen an increase in deaths. The yellow lines on this graph show days where there was a reporting anomaly. So where certain counties or states reported a backlog of deaths. And so we did have a few of those about 2 weeks ago, where there are some anomalies there, and you can see that the total number of deaths reported were well over 4,000. But more recently, we've just seen an increase in the last few days of deaths beginning to level out and even increase a little bit more. And so there's a lot of research and look into exactly what that means and why that's the case. Were there some backlogs that we weren't aware of, or are we actually seeing a true increase in death? And if that's the case, then we can't necessarily link it to looking at overall case counts, because our case counts have been decreasing recently. And so there is some question there about whether variants are causing sort of an influx or increase in these additional deaths more recently. Next slide. And so then again, just for your awareness, these different variants of interest or concern that are circulating around the United States and are in the news right now are important to discuss because they are becoming more prevalent. And there's a lot more research coming out now about them in terms of infectivity and also mortality. So the first one is this B1427/B1429. So it's two different variants, but they both have the same mutation. And that mutation is the L452R. So these are now accounting for about 50% of cases in California. Officials there in California believe, based off surveillance that they've been doing. So whereas back in October, November, this mutation was only accounting for a very small percentage of cases, 1 or 2%. It's now accounting for over half. So they have been seeing that increase in prevalence among this mutation. One recent study, I believe out of University of California, found that ICU admission among those who had this mutation was up about 4.8 times when compared to those who did not have the mutation, and mortality was increased by 11-fold for those who had that mutation. So pretty significant findings there. California officials are, of course, concerned about just the increased prevalence that they're seeing now with that particular variant. And then New York is looking at sort of a newer variant that they just discovered as B1526. And it does share similarities with the variant that was discovered in South Africa that we had talked about, I think, last Board of Health meeting. And there's some concern there that it may be even more contagious than the L45R in California. And then lastly, of course, is the B117. That's really the first one that made national news. That's the one that was first discovered in the United Kingdom. White House task force is concerned with spread that they're seeing up in Minnesota with the B117. Then other experts are looking at really the doubling of these cases more recently. So similar to what we're seeing in California with the L452R, there is evidence now that the B117 is beginning to increase in prevalence. So there, of course, is concern among experts that if that continues to double, then that would, of course, become a more prevalent variant in the country. Dr. Walensky at the CDC is still suggesting that the B117 may become the most predominant variant in the US by the end of March. Next slide. So then I wanted to share a few slides out of the Colorado School of Public Health. These are maybe a week and a half or 2 weeks old now. But they looked at a few different things, and I apologize for the quality. I just took screenshots. But they're looking at if we continue on the same path or trajectory that we are going on right now in terms of vaccination, and then including the Johnson & Johnson vaccine beginning on March 1st. So if we essentially look at the same rate of vaccination moving forward without any additional spread of the B117, then what would things look like moving into June? And so you'll notice that if our transmission control efforts remain the same, so that is things like social distancing, wearing masks, all of the other non-pharmaceutical interventions that we have been talking about for a year now at this point, as long as those remain high at 83%, which is the current threshold that they are sitting at, then you'll notice that by June, we get down to a point where we see very little transmission of the virus. If transmission control reduces from 83% down to 70%. So if individuals become more lax on distancing, more lax on mask wearing, hand washing, all of those pieces, then you'll notice that case counts really begin to level out. And then if transmission control reduces even further down to 60%, that's where you see that orange brownish line, and that's where we begin to see an increase. And this is without any sort of variance being factored into the equation. So transmission control and really holding the line and making sure that we are, as a community, continuing to adhere to all of those transmission control techniques is extremely important moving forward to ensure that we can continue to suppress the virus. Next slide. And then this one's looking at the B117 and what Colorado is simulating may occur. This is not by any means what they expect will happen. It's more of a simulation based off different models out of the UK. So really the main thing to look at over here is on the right-hand side. So they were showing that back in January, the 26th, we had a very diminished presence of the B117 variant in Colorado. And then right now, right around the 26th of February, we're seeing that about 10% or so of specimens that are being processed contain this this variant, the B117 variant. And so if the models hold true, right, and the B117 continues to multiply, then by the end of April, Colorado or CSPH is expecting that we would see majority of cases in Colorado would be that B117 variant. So again, this is dependent on a lot of factors, and there's a lot of other things that they have assumed and that they have sort of put into this model. So of course, it's not going to pan out exactly as they're expecting, but they do expect that we'll continue to see this increase in this variant due to its more infectious nature. Next slide. And then this was interesting as well. So, overall across Colorado, we've been seeing cases decrease. However, Colorado School of Public Health and Dr. Hurley, who presented this information, found that in the mountain region, so Central Mountains and then the West Central Partnership, had been seeing still an R0 rate over 1. So which shows that there are still more individuals getting infected than not. And so again, that number in that second column there, we want that below 1, because it's above 1 means that we'll continue to see infections increasing. 1.1 means that it'll be a smaller increase. It won't be as steady as if it was 2 or even higher. But 1.1 will still it still will cause an increase in cases. And so this mimics what we saw back at the beginning of the pandemic, where the mountain regions were really being hit at a much greater rate than Front Range or other counties in Colorado. And so, there is some, the School of Public Health is looking into this to really understand what it means. And if, maybe it's just a blip due to tourism after, the winter season begins to peter off, we'll begin to see this decrease. But there's no real conclusion on what it means exactly, other than, we're seeing this proliferation of disease in the mountain region of Colorado. Next slide. And then this sort of just, it kind of matches what the School of Public Health was showing, in that you'll notice that, again, the mountain region counties are in red, and this is using a 2-week incidence rate. So it's using the dial metrics that we were used to for so long. So you'll notice that Grand Eagle, Summit Lake route, and Rio Blanco, they are all in the red in terms of incidence rate. And then a lot of other counties across the mountain region also in orange. San Miguel and Ouray also in red, so Telluride area. So, again, it's not very clear exactly what this means, but we do know that there is an increased prevalence of COVID in the mountain region of Colorado. Next slide. So then finally, just looking at where we stand currently, and I do want to add a caveat here before explaining this information here. And due to the power outages in Texas last week, there are hundreds of specimens that were still being processed at Microgen Lab in Lubbock. We actually just received 20 new cases before this meeting, so we can essentially add 20 cases to this here, which would increase our incidence rate up to about 265 if all of those cases were to be having occurred within the past 7 days, which they likely will be counted for the past 7 days. So that would push our incidence rate up much higher than this graph even shows. But aside from that, I think this graph really it shows that our incidence rate has remained fairly steady over the last 2 weeks since the 12th. We've seen it ebb and flow a little bit, which is to be expected when you have a county the size of Pickens County. We will always see sort of that ebbing and flowing, but it has remained pretty consistent. Again, though, with the processing delays at Microgen, the data is a little bit skewed. And so in the report, that we will be pushed out tomorrow and on the website, the updated incidence rate will be made available and will be evident. And I think we will see an increase in our incidence rate due to these additional cases that have come in. Again, it's going to look a little bit skewed because all the cases were reported today. And so it's going to look like our incidence rate rose right now, just on the 25th of February, when really these specimens had been collected over the past week and a half. And so they really shouldn't all be counted on today's date. But we will see an increase in our incidence there. Then our positivity rate, we were able to finally get some other labs to take their information and include them in our positivity rate. And so it is going to look a little bit different from what we had been seeing, which was down in the 2%. Now that we have all of our other labs incorporated and we're able to use their data, our positivity rate is up closer to 5% or so. Still a lot better than where it had been previously last month, but a little bit higher than what we were initially projecting. Next slide. That's it. Oh, and then last thing is our variant cases. So just wanted to share on this. So we still have had 0 confirmed variant cases in Pickens County. We do have 3 suspect cases that we are working on. I apologize. We have 3 suspect cases total that have been reported. We are working on 1 currently. There were 2 that were initially reported to us back in early February. We felt like we were able to contain those. We do have 1 new one that we just started working on that was reported this week. So that is in progress and not a lot of information to share on that. Across the state, there have been 86 variants of concern confirmed and identified, and there are 36 variants under investigation. So our 1 case is in that under investigation row. But that's where we stand in terms of variants. And I think that is all the information I have. I'm not sure if I'm passing it off to Dr. Levin at this point. Okay.
Tim?
Questions?
Yeah, go ahead, Tori. Let's do some questions, Josh, and then we'll flip right over to Dr. Levins. Yeah, Tori.
Thanks, Mark. Yeah, I appreciate that. Josh, I have, I guess I have 3 questions. And I'll give all 3 of them to you, and then you maybe can come back to them. The first question is about the variants. Are they more severe and more transmittable because that's what the virus is trying to do? Is it by nature it is adapting to be able to be transmitted more? Is that why the variants are of such concern? Question number 2 is what have we seen in places about any health order changes that are specifically addressing variants, if any, if that is something that is happening? And then what you were just talking about, the Microgen backlog of reporting, you kind of just said there that you're going to, the 20 that you just received, you're going to put them on 1 single day of reporting because you just received them back, but that is not tracking them according to when they were in process. So are we reporting the Microgen backlog in the most informative way that we can? Is that not an accurate way to do it, to just lump them all on the day that we've received them back? Those are my 3 questions.
Great, thanks, Tori. So for your first question, yeah, I'd say, viruses continue to mutate and they continue to adapt to their environment. The less advantageous mutations are going to, they're not going to continue to spread. And the more advantageous mutations will continue to become more prevalent. And so I think that's what we're seeing here is that the virus is adapting to the environment and it is becoming, more contagious and more transmissible. It's really the adaptations to the spike protein, which has, you probably heard about. And so as the virus's spike protein is mutating, that's where a lot of the, vaccines have been targeting was that spike protein. And now that the virus is sort of mutating on that spike protein, that's why we're seeing, some more transmissibility among it because it's just able to infect our cells at a much greater rate than when it did not have those mutations. So it's a very simplified answer. There's a lot more that, I think, we could probably explain that could go into that. But essentially, yes, it's adapting to its environment and becoming more virulent. And then in terms of health orders, there haven't really been too much in the ways of trying to contain variants when it comes to specific health orders. The one main change is that anyone who is exposed to a variant or a suspect variant does need a quarantine for 14 days. That 7 and 10 day option that the CDC made available to us back in December is not an option for the variants at this time. The question was asked, once the variant becomes, likely to be the most prevalent in the state. And so, most people who have COVID have a variant, will all then be required to quarantine for 14 days. And there was not a great answer on that at this point. So not sure what that's going to look like moving forward. But at this point, anyone that's exposed to the variant would need to quarantine for 14 days. There's also been discussion around double masking, which I think we talked about last meeting. That's another strategy that some health departments have been using as well to try to do their part in containing any sort of variant spread. And then lastly is for the backlog. So, initially we were counting cases based on the date that the specimen was collected. And that's how we were tracking cases. CDPHE, when they roll up the dial, they started tracking cases by date of lab result. So because all of these resulted on the 24th and 25th, they would all get counted for the 24th and 25th. So to your point, is it the best way to count cases? No, right? They should probably be counted by specimen collection date. But to try to be consistent with what we're going to see on the dial, we would be counting them based on the date that the lab was received. I did email CDPHE to see if they were going to adjust how they're counting these cases because of the natural disaster in Texas. But I have not, we haven't heard back from them yet.
Okay.
Thank you so
I
much,
saw-
Josh. Thank
yeah.
you.
Tom, did you have your hand up?
I was going to comment that the cases are back counted to the days that they are added. If you watch the SIRs, those will change when the new cases are added on those days.
Thank you, Tom. Dr. Levin? Oh, I'm sorry, Brent. I didn't see your hand. Now I do.
All right, yeah, just a couple of quick questions for Josh. One, what's the quarantine requirement if somebody has been completely inoculated, had both inoculations and even say 2 weeks past the second? Does that affect the quarantine requirement?
Yeah,
And
so
then-
individuals that are 2 weeks past their second dose with the Moderna or Pfizer vaccines at this time are not required to quarantine if they are exposed.
Okay, great. And then the second question is that California variant, the L452R, those numbers, I've not seen them up against the others quite so dramatically. You said that the ICU admissions are up 4.8% or potentially, and mortality increases 11, not 4.8%, 4.8 times, and mortality increases 11 times. I mean, that is extraordinary. Now, are you saying that this is for an individual person? These are the odds that increase, or are you talking about potentially statewide increases in ICU admissions of literally 5 times and mortality is up 11 times?
So the study that was performed was on a pretty small sample size. I forget exactly what it was, maybe 40 or 50 individuals. And they compared those who had the L452 4.52R to those who did not. And what they found in that small sample size was that those who had that variant were 4.8 times more likely to have been admitted to the ICU and 11 times more likely to have died from
Okay.
infection with the variant.
Really just an indication of seriousness as
Correct.
opposed to specific. Yeah, got it. Thank you.
Yes, exactly.
Dr. Levin?
Yeah, hi, thanks. Yeah, and just another note on the variant conversation, that it is that the virus mutates and it's basically for its survival. And the ones that can latch on the hardest, I know Tori, there some of those questions about like what exactly are the mutations, a lot of it, as Josh said, is in the spike protein. So the ones that can latch on and get onto cells in a better way will survive more. And then, so right now we're in this somewhat of a race with vaccination and then these variants coming up. And although COVID does mutate slower than flu, I think in a pandemic, it is a huge concern. And the data out of California is really early. And I think there's definitely a concern that there's higher mortality and higher transmissibility. Although I think some of the numbers are just so early right now, and the exact numbers really are very on small subsets. So I think a lot of that will come out, but I anticipate more, as everybody does, more of these variants coming out, and we're really kind of racing against it. And I think that is a real concern in terms of being very diligent right now and continuing to be diligent in terms of decreasing transmission of the virus. There are, I don't know if Josh, you said this, there are about 1,900 variant cases in the United States. Colorado has 85 cases of the UK variant, so it's the predominant variant case here. And I believe Garfield has 5 positive cases, although we haven't identified any. We have to assume that is likely here. And there will be increases to it. So I just wanted to show the matrix as we always look at it, and everything's in a comfortable state. The numbers are in comfortable, in the green on all levels, on inpatient, on outpatient, and healthcare workers. And this is very reassuring. The numbers are, the incidence rate in the community is very reassuring at this point. However, again, I think the main message is to be diligent. The next slide, please. Of the matrix, I thought it was interesting just to take a moment to talk about the healthcare workers and the numbers of healthcare workers out. So this is the graph from March to the present, and you can see the March spike, and then the increase from September all the way through to January, and then a significant decline since then. And now we are, the yellow line puts us in the green, which is below 6 healthcare workers out with COVID-like symptoms. Although we did spike at one point up to 40 that had COVID-like symptoms and quarantined. Now we have 3 that are out. Interestingly enough, all 3 that have COVID-like symptoms, none of them have been vaccinated. And so I think what's interesting about, and the hope that the vaccine is bringing, that the healthcare worker, this is a subset in our community, and we have about 77% of all AVH healthcare workers vaccinated. So high percentage of healthcare workers that have had the double vaccine at this point. And although there are so many different factors that have contributed to our decline recently in incidence and this decline in healthcare workers that are out, we have to hope and believe that the vaccine is really having effects on it. And highly suspicious that the vaccine is working and it is providing hope. And right now there's a very high volume vaccine clinic going on. And I think we have a system set up here in Pickens County that is efficient, and we can handle vaccinating as many vaccines as we get in our hands. And that's happening today, over 1,000 right now. So I think the vaccine is providing hope. My main message here, as Josh's data had shown, and the concern that potentially we're leveling and maybe potentially we're actually going to go up, is what's going to happen over the next few months. And really at AVH, although the vast majority have been vaccinated, double vaccinated. There is a continued diligence. There's a continued diligence in mask wearing and hand washing and social distancing and maintaining all of that and screening, continuing to screen and doing everything that we did before the vaccine and continuing that. The other issue is the quarantine, which is nice that if you're double vaccinated, especially for a workforce, that your workforce can remain more intact and come back. And in addition to not having to quarantine if you're double vaccinated, you do have to monitor yourself for 14 days for symptoms. So really closely monitor yourself. So it puts a little more on yourself in terms of if you have any symptoms within a 14-day period that you need to that you cannot return to work. So I think that is one of the main messages. If we start relaxing any measures after vaccination, I think we are putting all of ourselves at risk for a resurgence. And again, it's going to be really interesting to see what happens over the past couple of months. I know we've been in the yellow for a while. The incidence rate is low. It's really exciting. The vaccine's rolling out. However, as we had talked about kind of earlier in the pandemic, that there potentially is this dance going on. So once the rates go lower and people relax, then the numbers start rising again. And so we really want to try to prevent that from happening. I think Josh had mentioned the double masking, which was a study that came out in the CDC's Morbidity Mortality Weekly Report. That is something to consider, that if you are in kind of a very closed quarter and close to people for a prolonged period of time, that we are finding that double masking, which makes a lot of sense, and the fit of the mask is really important, that does decrease transmission. So that is something to consider. And then another thing that came out in the MMWR this week, and I just wanted to make a note of it, is gyms. And so gyms, there was an outbreak in Chicago that showed 81 attendees, 68% developed COVID symptoms, 68%. So gyms are really high risk. And as we're in yellow, gyms are opening up. Just a kind of a warning of caution to everyone to please mask, hand wash, use every technique for decreasing transmission, and know that you're in a space that's enclosed, that there's kind of an increased respiratory exertion. And so there really is increased risk of transmission in gyms. I think that's it. If there's any questions? There's certainly so much more to talk about.
Any questions for Dr. Levin? I don't see any hands. Thank you so very much, Kim. The next item is the primary issue that we want to talk about today, and that is the Traveler Affidavit, and Jordana will lead us in that conversation.
Bill, did you have a question before we?
Yeah, Dr. Levin, I've been talking to a lot of our guests here in Snowmass Village, and it seems like the predominant theme is people who have had COVID. What I'm hearing is, like, if it's a spouse that got sick and the other one's taking care of them, they're eating and sleeping together, and the spouse never tests positive, never gets sick. Is that something that you're hearing at the hospital as well?
So the question's about if you're in a very close space and in a home with someone who's had COVID-19, are you, do you assume that you already had it?
This is what I'm hearing from some of the guests that I talked to is one of them got sick, the other one didn't, never tested positive, but they were eating and sleeping together. And is that something that you're hearing as well?
Yeah, I mean, I think a lot of these assumptions, which can be dangerous, are that people have in terms of, you know, just because one person had it in a household, you assume that the others had it and they therefore have antibodies and are protected. Again, you can't make those assumptions. Yes, you're at higher risk, of course, but there's also a lot of cases that people in the same household did not get it and it did not transmit and they did a good job. So I think that it's an assumption and it's really not good advice to go on that type of assumption. And again, we don't know how that is going to change behavior, right? you still need to maintain the 5 commitments. You still need to, even for people who have had COVID or assume that they've had it, we don't know how long the antibodies last. There's still so many unknowns about it. So it shouldn't be changing behavior.
Dr. Kurt?
I suggest having the couple in Snowmass repeat their COVID tests as antibody tests at 2 weeks, in which there should be an antibody titer. Just relying upon a single test in that kind of situation, I think begs for a repeat test of some sort.
That's great advice.
I think
Thank-
that's good advice. And it's also good to remember the limitations of the antibody test, that it's not a 100% type of test, and that it has its limitations as well.
Okay, any other questions? If not, I'll turn it over to Jordana.
Thanks, Marky. So the board had asked today for staff to be able to go back and bring forth today some information about the Traveler Affidavit. What do we know, and what do we recommend for going forward? So I will start with, these are the goals that back in November, when we were discussing the Traveler Affidavit, that were discussed and agreed upon. The goals of the program being to reduce the likelihood that travelers will arrive in Pickens County with current COVID-19 infection, to reduce the number of Pickens County residents infected with COVID-19, to maintain adequate capacity at AVH, and to make Pickens County a safer community for all of our guests and residents. Next slide, please. So the question has been, what are the benefits of the program? The program, the Traveler Affidavit program, requires everyone coming to the community who is spending at least one night in the county to complete it. As they complete the form, it provides education on the current local COVID-19 requirements. So it provides information and a commitment to the 5 commitments of containment, information about our local mask order, quarantine and isolation requirements, and the current personal gathering requirements. So I think, as we all have experienced, the requirements and expectations that the dial demand and are changing and may continue to change frequently. And this is an opportunity for those that are coming to our community to be updated on what they should expect upon arrival. It also includes an attestation of either being committing to quarantine, to have a negative test, or that they've had recent infection or completed a vaccination, and that they wouldn't be traveling while sick. What we've found also of the program is that a huge benefit has been the partnership with hospitality partners. They have taken a huge role in pushing this information out, incorporating it into booking policies, putting it as pop-ups on websites, emailing guests with this requirement and information at different points in time, and have been real champions of the program. And this was really entered into as a partnership back in November as an attempt to contain and limit COVID transmission in the community. We think that the coordinated and consistent messaging for all travelers really helped amplify the COVID message to the community. So it does take a lot of effort to coordinate, but our communications team and that partnership with ECRA and the hospitality industry has been essential here. What do we know? We know that we saw a 260% increase in the website hits for the month of December over November. So we are inferring that a lot of that is because people were getting direct information about these requirements and then going to the website. And there were 76,000 unique page views to the Traveler program. It got the word out. The total number of people that completed the affidavit through the 22nd was almost 70,000, 69,964. So, I mean, I think that number is a huge number. It speaks to that is how many, at least how many people were educated on the requirements when they came here, and attested that they were going to come and align with those expectations in the community. Next slide, please. This is another slide that we really had presented earlier on, and I think it still remains true. So the lodging and hospitality community partnered with Pitkin County to inform guests of the travel requirement. There was a lot of conversation about what the role of the hospitality community was, and there was agreement that their role was really to inform on whatever that affidavit was that it has been decided. They ensured all reservations adhered to the personal gathering limit capacity. So as you know, that personal gathering limit capacity is indicated by the dial. Currently, we are at no more than 2 households or 10 people from no more than 10 people from no more than 2 households. And that is a requirement that applies to lodging situations as well. The goal is to reach the visitors before they arrive, and we are asking lodging and hospitality to be partners to help push out the Traveler Affidavit program and include that messaging to all their existing reservations, to integrate that communication into their reservation process and provide information to all arriving guests. We just want to acknowledge that we think so many of our lodging and hospitality partners have played a huge role in making that program and doing the outreach and having those affidavits completed. Next slide. So these were some points that we have been receiving from the community, from hospitality or lodging partners in our request to have this conversation today and really reconsider some of these concerns. So some concerns brought up were around the message aligning with the dial, but keeping the affidavit, they felt contributes to less compliance and more confusion for the visitor deciding where to spend their vacation. They cite that Aspen occupancy rates are the lowest of any resort in the state based on the most recent Rocky Mountain Lodging report for January. We do know January we went into red level restrictions at that time. The lack of enforcement and compliance verification of the travel affidavit causes additional frustration and strife on the lodge operators and their guests. And I think this is the point that a lot of folks who do follow the affidavit then show up expecting a similar response to what the National Guard is doing in New York State, having been checked and asked for verification, and when they don't see that, sometimes they feel frustrated. Confusing messaging regarding safety in Aspen or Snowmass when the metrics move us to the blue level on the dial, but we still require a signed traveler affidavit. So we're not yet in the blue, we're still in yellow, and as Josh just shared, with those additional cases that are coming in from Microgen, we are kind of expecting to bump up to that upper level of the yellow. So, I think that this is again that communication of things are getting better, but we're not quite totally in the clear yet. They cited that Alaska has dropped their travel testing requirement, and there's also some concern with the name affidavit and the legal connotation there. Again, to reiterate some of the benefits of the Traveler Affidavit program is that there was education provided on COVID-related restrictions. We know that over 69,000 have been completed to date. So folks that were coming knew what those requirements were. The attestation of quarantine and traveling while sick, understanding the Pitkin County requirements. And also, we do know that it prevented the introduction of new sources of virus. We have anecdotal evidence that's coming in bits and pieces of individuals who learned of the travel affidavit, were getting tested before they came, did get a positive result and canceled their trip or delayed their trip to be able to do it when they were COVID free. So because we are only recording negative tests in this portal, we don't have an option to say, I wanted to come, but I took the test and I tested positive. We can't quantify this. So we just have that anecdotal evidence. Another benefit is that positive national press that we were getting as being a county to implement this travel affidavit. Next slide, please. So the ACRA was leading a lot of discussions with their constituents, especially the lodging industry, trying to understand what the concerns were with the current program and what there would be support for going forward. And so we really appreciate that effort and partnership there. And what we heard was there were really 2 points. That there was support to align the program with the CDC recommendations for travel, changing that language from requiring a test to recommending a test, recommending following the CDC or following the CDC guidelines, which recommend a test or quarantine. Additionally, to change the name of the program to the Traveler Awareness Program, which has less of that legal connotation to it. So moving forward, we've got a couple data slides to show you here. Josh put this together, and this looks at in the black line, the mobility data that we've showed a couple times. So again, this is cell phone device data, and it's looking at the number of visitors per resident. So the higher the number, the more visitors we're seeing. And then we're looking at the total arrival numbers of folks that are indicating that they're arriving on that day on their traveler affidavit. And so what we're really seeing with this data is that the arrival dates and data is trending really along the lines of that mobility data. So this gives us confidence that people are completing the traveler affidavit in alignment with when they are arriving. Next slide. And this slide Josh put together to show that if you look, we'll look at the blue first, and the solid blue line is mobility data from 2019 to 2020. And then the dotted blue line is 2020 to 2021 mobility data, so this current year. Again, the solid lines are for surrounding counties that have ski resorts in them, and dotted lines are last year. Dotted lines are last year, and solid line, nope, I'm saying that incorrectly. The solid lines are last year, the dotted lines are the current year. Okay. And so if we look at those trending lines, we see that they follow each other. And it shows that the average contacts per device had been really similar between 2019 and 2020, indicating that people are traveling at similar rates, but perhaps lodging in different ways. So our average contacts per device rate was most similar between 2019 and 2020 in Pitkin County when looking at those 6 different mountain communities. So we're really trying to take the data that we have to learn and understand how people are still traveling and coming to our communities. And if we look at the next slide, there's some more data that this is also available on the website under our economic indicators. And this is data that ACRA makes available. And this is historical monthly occupancy. And again, looking at the most current year of 2020 in the green, and we see, the the lower overall, 2020 was a lower overall year for occupancy, whether we're looking at, you know, even before the traveler affidavit went into effect at the end of November. The next slide shows now short-term rentals occupancy. And we see 2020 in the green, so the most current year. And I think what we've been learning is that people are tending to come and stay in more of those VRBOs as opposed to lodges and hotels. It's been a change since the pandemic, and that's what we're learning. So I know we've got Debbie listening in from ACRA, some other folks. So if there is anything that I'm stating incorrectly about this occupancy data, please text me or pipe up in the chat, and feel free to jump in. But that's the understanding, is that there's been a little bit of a change in how people are, and the lodging people are choosing when they're coming to Pickens County since the pandemic has started. If we go to the next slide, this is data that we have pulled from the traveler affidavits. And we see that the majority of folks indicated that they were going to opt to take a test and have a negative test result before coming. And it also shows, and the other caveat in this slide is knowing that the vaccinated category was added at a later date, as well as the tested positive result was added at a later date. So what that means is that in the options in the traveler affidavit, it asks those that are traveling, when you come, do you intend to have a negative test before traveling? Do you plan to quarantine upon arrival? Do you plan to test upon arrival? Have you been fully vaccinated? Are you currently awaiting a result? Or have you tested positive for COVID in the past 90 days? And essentially, have you recovered from having COVID? So you've got that immunity for 90 days. Next slide. So since the establishment of the traveler affidavit at the end of November, so it was past the end of November, went into effect the beginning of December. What do we know that's changed? So we have confirmed since that time that the short-term lodging occupancy limit that's dictated by our place in the dial and the state is required to align with that informal gathering limit. We know we've seen vaccination. That is something new. We've got over 3,800 Pickens County residents that have been vaccinated, and this does make us very hopeful. But we also note that hospitality workers have not yet had the opportunity and the priority to be vaccinated yet in our community or across the state. Something else that's changed, now nationally, all international air passengers coming to the US are required to have a negative COVID test result or documentation before they board a flight from another country to the United States. We have seen a month of the declining incidence rate, which Josh has shared, which gives us hope. And at the same time, the discussion that both Dr. Levin and Josh have brought up around the variants that we have suspect cases of here, but confirmed variant cases in neighboring counties is something that still we have to see what this is going to mean in our community. Next slide. So taking all of this data, all of these points into consideration, the staff recommends that we retain the traveler affidavit requirement, including that information about the 5 commitments of containment, the mask order, quarantine and isolation requirements, personal gathering size, and an attestation. But that we update that attestation to align with the CDC travel recommendations, as was suggested by our lodging partner group. We can talk through this, but the proposed effective date is a week from tomorrow. We just know that there's a lot of different places that this information is, and whatever changes that we make, allowing ourselves more time to be able to ensure that everything is changed, that partnership that we have with the lodging community who is pushing out so much of this information and has it embedded in different places on their websites and their emails, that they have the opportunity to update, and that we're all be able to be on the same page when this becomes effective. The second recommendation that I'll talk through is that we do work with the Hospitality Task Force beginning in April, we can adapt this Traveler Affidavit program for the summer season. We know that those that travel here in the summer, it's a different type of tourists. There's a lot more folks that are coming here for the day. And wanting to make sure that this Traveler Affidavit program is still going to be able to help us accomplish the goals that we've set out together to be able to reduce spread of COVID in the community, transmission, and really hone in on that educational component. This is where I would recommend including a brainstorm on the updating of the name of the program to ensure that we've thought through all of the things and can put that together in time to kind of rebrand the program for summer, knowing that there might be some more changes and tweaks that need to be that need to be implemented, that need to be thought through. And we know that if we have a couple weeks to think through these changes, to get feedback and input, it's always going to be a better product than if we just turn around and make some quick changes in a week. So I've got a couple more slides. The next one would be, the changes that we would be sharing and making on the website. So, again, this is who is currently required to complete the Traveler Affidavit. Any traveler spending 1 or more nights in Pitkin County that has not been in the county for 10 or more days. So if it's a resident who's coming back to the county, part-time second homeowner, anyone who's coming back and has been out of the county for 10 days or more, that's who is targeted to complete the Traveler Affidavit. It doesn't apply to those that are visiting Pitkin County for the day currently. Parents are required to include all minors in their affidavit. We'd remove this language here around the requirement for the negative test and then better align with the language around the following CDC Traveler Guidance. And knowing that all travelers are still required to adhere to our personal gathering requirements in Pitkin County. Next slide shows this piece of the attestation that would be updated. So on the left is what is currently in the Traveler Affidavit. When you get to that question, you get to choose one option for that you've gotten a negative test result, or plan to get a test, or have taken a test and are awaiting a result, or you're planning to quarantine, or that you have had COVID in the past 90 days and are recovered, or that you are fully vaccinated. My proposal, or the staff proposal, is really that we would move to 3 options in this updated Traveler Affidavit. One being that you're fully vaccinated and coming to visit Pitkin County. One is that you have had COVID in the past 90 days and you're fully recovered. And then the third option is that you're following, that you would be following CDC testing recommendations for travel. That is, if we go to the next slide, this is just a repeat of those staff recommendations I went through. So I can pause here, take any questions, Marky, and turn it back to you for board discussion.
Questions for Jordana? Yeah, Tom.
I loved the recommendation with the understanding that the affidavit is removed and is called the Traveler Awareness Program. And as well, you might consider some incentives to the travelers. If you've completed this affidavit, you would get an N95 face mask equivalent saying something like, I heart, I love Aspen, or a coupon that might entitle you to so many, like $50 at local merchants, so that you create some kind of incentive for people to participate in this program.
That's a great suggestion. Brent? You need to unmute yourself, Brent.
Yeah, I think I totally agree with Tom. I think that's a superb recommendation. And, you know, an affidavit, the definition is an oath to be used as evidence in court. So it has, you know, legal force, at least it's supposed to. And, you know, I just did a quick math here, and, you know, 100 with 70,000 people participating at $100 for a short-term quick test. That's over $7 million of either their personal cost, of the state's cost. Somebody pays for it somewhere, at least in some proportion of that. So it's a very serious thing. So, and also the fact that this thing has not really been, we don't have the enforcement tools. We haven't used them, and at least as far as I understand. So I completely agree. I think the ACRA recommendations are excellent, and I think Tom's addition is superb.
Okay, Greg, good to see you.
Yeah, hi. I appreciate the conversation, and I agree with Tom. Certainly, I think we should incentivize this, and now would be a great time to work on that. It would be nice to have a pledge or some sort of commitment from a traveler coming here, so it's not just something they can discard immediately, because I do think this has had value, and as Jordana points out, incentivizing them, great idea, and I'm hoping we can work on something and everybody gets on board to do that. Certainly changing the name from affidavit makes sense, as Brent points out. If it's an oath and it's a legal oath, and if that's onerous for people, okay, let's find something else that works. I did want to ask Jordana, on the new pledge, or for the awareness, that they'll comply with CDC recommendations as you specify. Is that going to be a complete enough description that they really know what that means? Will we need to have more information on there so they really understand what the CDC is recommending?
Either way, it's right now, it's there's a link, there's a lot of information on the CDC's webpage. Those would be changes that normally we would just leave to the comms team and the staff who are updating it. If the board has specific feelings about what needs to be outlined there that are the CDC recommendations, we can do that as well.
I think that would be very helpful. I waded through the CDC website as well, and there's a lot of information there. So I try to do something as simple as possible, but still informative. And with that, I see Patty's hand went up.
Yeah, thank you. I just want to follow Greg on that. The Board of Commissioners did have the opportunity to discuss this. We looked at staff's recommendations. We looked at some of the issues with ACRA. The board was supportive of a name change. Greg was being very creative at the meeting. And we believe that the educational purpose of the current traveler affidavit is important to continue. Obviously, we've had 70,000 people get in touch with it, and the education of that is just commendable. So we would like to continue that. And also the Board of Commissioners, and Greg, correct me if I'm wrong on any of this, the Board of Commissioners was supportive of looking at the CDC recommendations for travel, not the flat out requirement of testing. And I think, Jordana, what you said, I think looking at, kind of fine tuning the CDC webpage to the issues that are most important here, because people will get lost in it. It is pretty voluminous. And we want to make sure that they don't click on it and then go, oh my God, I can't do this. So maybe we need to just highlight the points that are of greatest importance. But like you said, staff can work on that. But I think trying to do this as soon as possible would be great. I understand we don't really want to rush into things, but we have a limited amount of our ski season left. And I think it's important if we're going to do it to allow hopefully some recovery of our businesses in the next couple of weeks before the ski season ends. But we need to do it carefully and thoughtfully at the same time. So that's kind of a hard one to bring both of those factors in at the same time. But thank you.
That's right, Patty. I think that's accurate. Thank you.
Anne?
Yeah, just a very detailed point. It was interesting while you guys were talking, I pulled up on my phone the CDC travel recommendations. And actually, I don't know if they've cleaned up the website or not, but they're quite clear and they come up immediately as to exactly what you need. So I'm not sure your staff, Jordana, needs to spend a lot more time enumerating what those recommendations are. Yeah, I'll wait for Tori to speak too, but I do agree with the recommendations. And it has gotten interesting press. I mean, people appreciate things as a good idea, and I think places have modeled after what we've done here.
I just have a link to the CDC recommendations. That'd be pretty
Well, I
cool.
think that's in there. Yeah, that's
Yeah.
what Jordana is proposing. Yeah.
Okay, other comments? I see Patty's hand went up.
Yeah,
And I
just real. Yeah,
I also like the idea of some type of an incentive. Even if a $25 gift certificate or whatever to use at a restaurant or a local business would be fabulous. Okay, Patty, I'm sorry.
Yeah, that's okay. Two real quick things. I agree there's been positive press across the country, but that doesn't mean we haven't received negative press. There's been some comments out there about why is Pickett County think they're better than the rest of the world and requiring these things, and why is Pickett County scaring off their visitors. So there's both sides to that story. And as for the incentives, I agree with Tom. I think that might be a great idea. It's a matter of funding. And if you're thinking about coming back to the Board of Commissioners, we have this issue with, you know, how deep are our pockets, and our pockets are getting used a lot lately. So that would be something maybe we can try and get one of our, you know, our very generous residents to help us out within this community. Greg, I'm looking at you. You're so good at finding those folks, but that deserves further discussion. Thanks, Tom.
If, Marky, if I could tag on to that, I think it's a great idea to go for an incentive, and there might be something we can do that would be a gesture or a talisman from our community that people would really enjoy having. I'm not sure what it would be, whether it's a mask or something more fun than that. Maybe it's a gift certificate, but there might be a way we can do something that would be collectible and something people want that might just help push them over the edge and get them to join us with this awareness program.
Thank you. Other comments?
Marky,
Yeah.
can I just ask for some clarification in this discussion? Because I think what I hear folks agree with the staff recommendation, but then there's a little bit of a differentiation in what I'm hearing in some of these comments. So Lindsay, maybe you can just pull up that staff recommendation. So the first point was that we continue retain the traveler affidavit requirement. So I've heard overall, I've heard comments that are supporting retaining the concept, but not calling it an affidavit. So I want to confirm that it would be great if we could leave it to a future discussion with staff and our comms team. I know Tracy's on the line. There's been a lot of different names that have been floating around, whether it's the Traveler Awareness Program, whether it's the program, but then there's a pledge associated with it or a commitment. I think I understand that there's a desire to move away from affidavit, but just want to see if it's all right if we would be able to bring in our comms people to be able to really figure out what the clearest way would be to communicate that message. So I'll pause there. That's my first question.
Okay, so there's the first question that Jordana wants clarification on. Tom?
I'm suggesting the use of "I agree." As you see in so many of these internet things, you look at the 10 pages that you have to go down to the bottom. You pledge, you don't pledge, you say, I agree, which is a totally different concept. I don't like the term of I pledge or an affidavit. I think the term affidavit needs to be removed completely, and the term awareness or a more recommendation type of concept rather than a requirement. In addition, in the incentives, I think it would be a collateral manner to have a web link to the ACRA program. If ACRA wants to do something, and suggest that a member of the public health staff be an editorial consultant to ACRA, so that public health matters could be updated on ACRA as necessary, and be sure that there are not any misinformation in the ACRA information.
Thank you, Tom. I do like the idea that Jordana also floated, that the communications people are far better individuals than all of us collectively in terms of name of the program. So Brent?
Yeah, I just say, I again agree with Tom pretty much completely. I think the I agree is much better than anything that sounds too legalistic. I think the traveler awareness programs, to me, has a nice ring to it. And then against all of that, and I know this is a burden on certainly Jordana and the staff, is, time is really of the essence here. Every day is $1. And this program is, there's inherent expense and huge economic impact. So, I would say this is something we want to do as soon as we possibly can. And I realize that kind of flies in the face of being really, really careful with our steps. But I think it's very important to move forward with this thing as soon as we can, if we feel it's valuable, and I think it is.
I just saw Tracy pop up here. So Tracy, you have some comments as our communications expert here.
Yeah, no, I think everything you're sharing is really helpful. And what our team had hoped is just to have a couple days to kind of come back with how to get the message out there. One thing I want to share is we originally had thought we were going to have to do this by tomorrow if the decision was made today. And what that really does is put pressure on our stakeholders and our partners and the frontline folks who are going to be dealing with people who are like, hey, hold on, I'm confused. And we just know that because when the Travel Affidavit program launched, we probably had 500 or 600 messages and emails that came in that weekend alone. So we're just kind of asking for give us a couple days to kind of make the changes you determine are important here. And then I think some of these other ideas, which are great, might need a little bit, like the incentive program might need a little bit longer build out time. But I think, Brent, we can get the message out, by next Friday about this change. But this topic got a ton of interest, not only from people visiting us, but definitely from the media. So we know we just need to package it. And our partners have asked before. I talked to Jeff Hanley before I came on the meeting today to say, Jeff, your folks would be really having to deal with whatever this change is. And when we confuse people, we're just going to make people kind of upset that have already engaged with Travel Affidavit, and we've made the change in a day or two. So I'm just asking to give us a little bit of time, and I think we could get something. There's a ton of collateral material we created around this program. We did that really quickly when it went out in December, but we're looking for a week just to be able to do this well. And I think in that week, we're able to get ahead of the spring break, traffic that's going to be headed our way.
Well, maybe we could some way get the word out that, Aspen is back, with quotes, that there is a change coming. And, there's confusion no matter what. And you certainly need the time you need. But I just want to make sure that whatever we can do to mitigate the economic impact in the interim, because we are moving towards this more, liberal position, we should do.
Marky, you're on mute.
Okay. Tracy, thank you so very much for your comments. And we need to honor your request and give adequate time to the staff to really put together a robust program of communication. So I think you have a lot of support from the board to do so. And with that, I'm going to turn it over to Patty. You have a question?
Yeah, just real quick. I don't think we're asking for it tomorrow. I think the 5th next week, the date that was suggested by staff. Well, it works for me. I'm looking at Greg, but I think that works. And I too like the name Traveler Awareness Program, but if you guys find something more clever or more, appropriate. But I think definitely, Mark, you were looking for direction, and looking back at Greg again, the Board of Commissioners was, really moving towards getting that affidavit word out of there, making it more visitor friendly. And then we can also work with staff on if we're going to do an incentive program of some sort, in the next couple of weeks. I don't think that's as important right now as it is to change the name and do the CDC recommendations for travel. Thanks.
Okay, I'm going to see if Tori or Bill have some comments as our two mayors.
And Marky
Bill?
Linda's had her hand up for a while.
Oh, I'm sorry, Linda. Bill, can you go ahead and speak from your perspective, Snowmass Village?
Yeah, I think the Snowmass Council will be very supportive of a name change and removing the requirement. I would say the sooner we can do this, the better. If we can, even a week is a long time. I understand the administrative challenges. But again, I think the sooner we can, put this in place, the better.
Thank you, Bill. Linda?
I was thinking, and I totally agree, and I like Tom's suggestion about the incentive. And since most people come here to ski, that perhaps the ski company might contribute some kind of incentive, whether it's a small amount off the lift tickets or something that involves skiing. Since that's the major reason why people are going to come here in the next couple of months.
Hey, Tori?
Thanks, Marky. I want to share that this city council is split on this topic. And I mean that both from a perspective of retaining the requirements, but also just individually. We want to recognize that we feel like the travel affidavit program to this point was a good move, that we were supportive of it at the time. And that we think that these changes that are being proposed and recommended by staff are acceptable to us. I didn't have an opportunity to speak with each one of them about the name change, but I think that that is something that we understand, especially as the conversation here around the word affidavit has developed, and the information that Brent kind of shared about what its actual definition may be. So I can support the staff recommendations that were brought forward today. We appreciate it.
Marky, can I make one more clarification?
Yes, go ahead. Okay, go ahead, Jordana.
Okay, so I think there's been a lot of conversation around the requirement piece. And so the staff recommendation, I don't know if Lindsay, if you want to pull that up, just so to be clear, is that we continue to require that that those that are traveling here complete this pledge or agree with the Traveler Affidavit Traveler Awareness Program, but that the expectation is folks are still, the requirement is that they are getting this information, signing that box. I've read this, I agree. The point of clarification around the requirement piece is that it was that attestation to align with the CDC travel recommendations. So the rub that we had heard in the community was that we were calling out, you have to have a test before coming, and that there was concern that was that people were only understanding that was the only way that you could come and visit here, and was limiting people and making Aspen a choice to visit. What we feel like by saying, back to the slide with those three options, that you're either vaccinated, let us know, that's fantastic. You've had COVID in the past 90 days and you're immune, or that you're still committing to follow the CDC testing recommendations for travel, so that that is the requirement piece that was being changed, but that the everything else in this program, whatever Tracy's team decides to call it with all of their expertise, there's such educational benefit to that, to requiring that educational outreach of the program. We feel that there is benefit in that.
Okay. You want to go on, Tom?
I think that we need to get that word attestation, which is like taking the oath that Brent pointed out. We don't want this to be a legal affidavit document. We should say, I agreed to follow the CDC requirements, and get that word attestation, oath, or affidavit concept out of there.
Marky, if I could comment, Greg here.
Yeah, great.
I was wondering the same thing. To me, it looks as if we haven't really changed up this requirement. And I want to be clear with that, because it wasn't what I thought I was expecting to see when I came in. So we're attesting that we're going to either get tested before travel or get vaccinated, or, so how is that different? We're just changing the word, but we're still demanding this from people. And is this going to still have the same effect? I want to make sure everybody knows what we're getting here, because I wasn't quite clear. So if you don't mind, Jordana, I appreciate you bringing it up just now, because that's what the question I was going to ask. I want to make sure I understand that this aligns with the CDC. This is what ACRA recommended, but it's also what public health is comfortable with recommending as well. And I want to make sure we're clear on that. Thanks.
I can state what I've heard the board has discussed and what I think I hear agreement around. So I hear that the name change is essential, that the board would support something that is an agreement, an awareness program, a pledge, but nothing that says affidavit or has a legal connotation. So I think that is a major change. I also hear that there is going to be a change to the language around what folks are, the options that they have for selecting how they're going to travel here safely. Whether they're being vaccinated, they're already fully vaccinated and coming here, and saying that's what I'm committing to. I've had COVID recently, and so I'm letting you know that's my pledge, or I'm agreeing that I'm going to follow those CDC travel guidance.
And the CDC travel guidance includes this, that they've had a test prior to travel. Is that correct? I want to make sure I'm making that connection. Just want to make sure I'm making the bridge, so I know it's included in that. Thank you. Okay, so we're lined up with.
We can pull that up. So the CDC Travel Guidance, Lindsay, I don't know if you can go and click on that link. On slide. The prior slide. There you go. So this is the CDC travel requirements. So again, there is the international requirements that's a test right now. Test is required for anyone traveling internationally. If we go down lower on the page, it reiterates some of the points that if you're exposed, you shouldn't be traveling. If you continue to come down, there's a couple graphics that are very helpful. And so this is just stating, there you go. If you must travel, you can be vaccinated. It's recommended to get tested with a viral test 1 to 3 days before you travel. Keep a copy of your test result with you. Do not travel if you test positive. check travel restrictions before you go, masking, distancing, hand washing, all of that we know. If we go down lower, the CDC is also providing travel guidance for before travel, which they outline here, and then also after travel.
But Jordana, these are recommendations. The CDC, the only thing that's really required now by the federal government is masks when traveling. It's a requirement. But the CDC is recommending you do these testing. It says recommend, if you go up, it says these are things you should do. It doesn't say these are things you're required to do. Right? Okay, thank you.
Okay,
Thank you for going over that. That's clear.
okay.
Just
Other
maybe-
comments, Kim?
Yeah, no, I just wanted to clarify with Jordana, which I think that is a very important clarification. So we are requiring that an agreement is done for each traveler. And in that agreement, which makes most sense to me that it be a traveler agreement, that it increases awareness of what the CDC guidelines are, which are recommendations. And then there's 2 exemptions to that. One is double vaccinated and the other is having COVID-19 within 90 days. It would make most sense to me to put I agree to the CDC guidelines first, and then maybe a couple bullet points of what they are, that they are recommendations, and then put the 2 exemptions on the bottom. So it looks more like this is the piece that we're all agreeing to. We're increasing awareness about this. This is what we're aligning with CDC, and these are the main bullet points. And then there are 2 exemptions to this, the vaccination and having COVID with it. That makes most sense in my brain. So that would at least increase the awareness and show that this is actually a requirement to check this agreement, but the agreement is a recommendation. So you're taking that requirement piece out for a testing. That's kind of the main thing, is you're taking the requirement of a test out, right?
Right.
Okay, just my recommendation.
I think that is excellent suggestions. Thank you, Dr. Levin. Okay, Tom, any comments or?
I agree with Kim wholeheartedly.
Okay, thank you. Jordana, do you need any further clarification, or can I take a consensus? Just read the tea leaves here.
Tracy, I know Tracy, a lot of this is going to fall to your team. So I just want to also give you the opportunity, if there's anything else, any additional clarifications your team would need before moving forward on this.
No, I think everything you've shared here is very helpful. And I think what Kim just shared is perfect, the kind of just cadence to how we do this. So it makes more sense. And that's what we'll start to dig into probably right after the Board of Health meeting. Thank you.
Okay, just a consensus. Can I see a show of hands of all supportive of the direction that has been moved forward? And I'd like to see all the alternative members as well. So it's unanimous that we move in this direction.
That's great, Marky. And then I would just, I think the second part of that recommendation was then just to continue to, we know we're going to make this change in a week. It's going to be fast. I'd like to continue to proceed to get together with the hospitality task force and our comms team to see if there's additional changes that we would want to make sure that it applies to our summer visitors. And then if there's any recommendations, we can bring those back to the board.
Thank you. You have everyone's full support to do so. And with that, let's move into a very important topic called vaccinations. I see Carlin.
Hi, everyone. I'm going to give a quick update on vaccinations and where we're at in the process. So to just recap who's currently eligible for vaccinations, we're still including folks in 1A and 1B1, and we're currently working through 1B2, which includes our educators, childcare workers, and our individuals aged 65 to 69. With that group, we actually have had less folks than we anticipated for 65 to 69. So I wanted to call to action. If you have not registered for vaccine notifications, if you're 65 to 69, now is your turn. Make sure you get in there so you don't miss your opportunity. And next slide, please. these are the clinics we have going on this week and kind of what's on the horizon for next week. So currently we have a first dose Pfizer clinic operating at the Mass Clinic location, which was rescheduled from last Friday. We had some delays from the winter weather last week, which was challenging to accommodate. So we are rescheduled for this week. 2 months into this process, though, that's not a huge burden considering that we've had a lot of vaccines show up on time. So hopefully we don't have that happen in the future. We're still going through 1A, 1B1, 1B2, and starting to dip our toes into 1B3 as soon as we're able to here. Tomorrow we're doing second dose Moderna. And in terms of next week, we're looking at doing another massive second dose clinic on the 5th of March. In addition to that, we've also requested another full flat of Pfizer to see if we can do first doses, but we're still waiting to hear from CDPHE whether we will receive those or not. And we do have smaller clinics that happen around the county or in other places serving Pickens County residents from Mountain Family Health, Voices Unidas, City Market Pharmacy is also receiving vaccine. And we're working with Community Health Services to figure out how we kind of create different sort of equity pop-up clinics going forward. So 1B3, just to kind of touch base a little bit on the future, we are expecting a governor's press release tomorrow or a briefing tomorrow where we may see some changes to 1B3. So take this all with a grain of salt, but as of right now, we're looking at frontline essential workers and folks who are 16 to 64 with 2 or more comorbidities. The folks who are in the essential worker categories that we've been reaching out to are the folks who work for grocery stores, food banks and pantries, essential human services and public health, public transit, postal workers, and frontline journalists. Next slide, please. Okay, and I wanted to touch base a little bit on vaccine accessibility and equity. I know this has been a question that we've been working through with different groups. We did have an equity plan that was submitted to CDPHE that included our Latinx outreach plan, as well as a dive into access and functional needs. So I wanted to touch base on that really quickly, what exactly that means. The IMT, our incident management team, and emergency preparedness loves acronyms. I know the rest of the world doesn't. So access and functional needs, you may see AFN in our plans and different types of communications. All that really means is you need something, and we need to make sure that we're equitably allowing folks to access the services that we're providing. So our incident management team identified someone from our human and services team to be that access and functional needs liaison, to act as a case manager when we have someone identify that they need help in terms of any of these types of functions below, that we can connect with them and figure out how to best serve them and make sure that they're able to access vaccine. So these are kind of the aspects of access and functional needs that we need to consider. And there's kind of 2 that have kind of risen to the fore as priorities, and that's communication and access to transportation. In terms of communication, we do have obviously our website set up and are directing people to register for those notifications. If they don't have internet access, we do have a call center set up as well. If folks aren't comfortable with that dynamic, we have other alternatives in terms of language as well. So offering all of our scheduling in English or Spanish, and then making sure that we have that opportunity for folks to identify if they need assistance. So access transportation, if folks are not able to make it to the drive-in location, I'm trying to figure out how to either get them there or get to them in terms of a mobile clinic. Other aspects of access and functional needs include maintaining health, being independent, accessing safety, support, and services. And those are things that are essentially being identified and addressed through allowing folks to access vaccinations. Next slide, please. Okay, and in terms of where we're at, we do have a vaccination data dashboard, which is helpful to look at. A little caveat though, we noticed, which is great to have our own data team to be able to kind of double check what we're pulling out of CDPHE's database. There is a little bit of a delay. So if you see kind of a decline, it looks like we've been administering less doses over time. That's because there's a delay after the 6th of February there. So we don't have complete data for those last couple of weeks. That will be updated very soon. But the reality is we actually have administered more doses than we're seeing in the dashboard, which is great. There is different capacities to look at just Picken County residents versus all of the vaccines administered in Picken County. And it's very detailed in terms of whether it's been Moderna or Pfizer. So definitely check that out if you're interested in what's been administered and where we're at in the process, and expect it to increase over time. Next slide. And just another call to action, make sure that you're signed up for vaccine notices so that when those priority groups change on a dime at the governor's briefing, we're ready to communicate with you and get you signed up for an appointment. So that's still our main way to get folks registered, is sign up for notifications or call and make sure that you're in our system, and we'll reach out to you when we're ready. And I think that's it. Stop for questions.
Questions for Carlin?
I've got one.
Yes, Brent?
Yeah, just quickly, Carlin, of the second doses, how many, what's been the success rate or performance of people coming back for that second dose? Is it less than 100%, or, and if so, what do you do with that, promised second dose that we've set aside?
So we certainly are trying to get folks back for their second dose. If you miss your appointment, you're no longer guaranteed to receive that second dose. Because of the waitlist system we have, we want to make sure that everything we receive gets administered as soon as possible. So we're making sure that people know when they sign up for their first appointment, please make sure that you're here for your second appointment. If you miss your second dose appointment, we can't guarantee that it's going to be available for you, because we will fill that appointment with someone from the waitlist.
What's been that rate? What's been that, any guess on that percentage? We like 95% people come back to the preset.
So we're kind of, just in the middle of a lot of our second doses now. So I think until we get that data updated, it's going to be hard to say exactly how many we've had come back yet. But it is data included in the dashboard, but I'm not sure just off the top of my head of what the return rate has been so far.
Thank you.
Yeah, Jeannie?
Carlin, is there any information about whether the Johnson & Johnson vaccine is going to come to Picken County?
Yeah, so we're definitely expecting that and starting the conversations to think about how that might change the dynamics of vaccine distribution. We haven't been able to order vaccine or really know from CDPHE what that looks like in terms of our allocation. But knowing that the storage requirements are different, we're thinking that there may be some interest from other providers to start offering this in the primary care setting. Initially with the Pfizer and Moderna vaccines, that was not particularly appealing, and there's still not a ton of interest necessarily. But Dr. Levin and Dr. Bernard are planning to hold a community physician meeting to discuss kind of the implications of the Johnson & Johnson vaccine and whether, expanding providers at this point is an option, especially as we start to talk about folks who are those folks who have the comorbidities and how we're kind of reaching them potentially through their PCPs. I see Kim hopped on if you have any thoughts about that to share.
Yeah, I think what's so great about the Johnson & Johnson, and it's being discussed today, and likely we anticipate it being approved tomorrow. And I know everything is getting ready for it to be even sent off by next week. So I do expect that we'll get it. The nice thing about it that Carlin pointed out is that it is a single dose and it only requires refrigeration. So the logistics of it are so much easier to be able to get to small subsets of the population and to be able to administer in smaller sites. And also that, there's conversation that it's less effective. Honestly, it has the effectiveness that's similar to previous vaccines like the MMR vaccine. And I think the messenger RNA vaccines really have raised the bar so high. So what Johnson & Johnson vaccine does is it prevents about 100% of severe disease and death. And that's really the best endpoint to look at it. And it says 66% effectiveness after a month for preventing moderate and severe disease. So these are great endpoints. I think it's going to be really useful. And I do think that we'll get it.
Yes, Tom?
Those are great points, Kim. I'd like to add that in March, the vaccine manufacturers have said they're going to markedly increase the shipments. So what are we doing here to be able to accommodate those new shipments and also to implement the vaccination, which would be very helpful for our county?
Yeah, we're ready to roll in terms of receiving more vaccine. We can do 5,000 a week at our current operation. So Again, we're excited for more vaccine. I do expect the Johnson & Johnson vaccine to increase our supply. I know Colorado has some estimates of what they expect to receive, and of course we'll get some of that. So I think that, you know, we already have the infrastructure set up to do a lot more than what we are receiving. But we keep being told that, you know, any day now the supply is going to increase. So we've built the infrastructure, and we communicated with CDPHE. We can do 5,000 a week if you give it to us. So.
Well, Moderna and Pfizer are going to markedly increase the shipments, and Johnson & Johnson, which is being reviewed today by FDA, is expected to be approved by ACEP for CDC on the 28th and the 1st. So you're going to see that come out next week also, all three.
Patty, you had your hand up.
Yeah, Carlin, really quick. I know you're always looking for people to help out over at the music tent. So I'm going to open it up to the Board of Health members that if you'd like to assist in getting these vaccines out, I'm sure we can find a use for you out there. So Carlin, if you can tell them the best way to get hooked up, and there's things that any and all of us can do out there. And I'm just working on a date when I can come out and spend the day with everybody. So Carlin, if you can let people know how to get hooked up to it, that would be great.
Yeah, I'm actually going to kick this over to our incident commander. I see Phyllis is on the call. How should we best
she's out
support,
there, I
how should
think.
we integrate our Board of Health members into our, you know, exciting, and it is a feel good experience. So I want everyone to be able to see kind of the operation for sure. Go ahead.
Hi all. Melissa Knight, who's a Pickens County HR member, is the coordinator of all our volunteers. So it's melissa.knight at Pickens County, Knight, K-N-I-G-H-T, at pickencounty.com. We can get that all to you, and that's the best way to connect. We have ambassadors that help people through our lanes. We have registration. I will say we totally revamped our registration today, and we're doing 1170, and the speed that people are going through the tent is amazing, to the point that the pharmacists got behind on creating doses. On the Pfizer, they only have an hour from when they're in the whatever it is, in the shot, to be able to get it into an arm. And it's moving really quickly. So 1170 moving quickly is really amazing. Brett, I do have a number for you. We're at a 98% on second doses. And typically it's people who are either sick or had to go somewhere. We're also wrestling with people who've had their first dose somewhere else and are coming here and want to know about second doses. I think we're going to end up with more of that. But I will say we have never not gotten a dose into an arm. We are at 100% on that.
Is there a number? Because Carlin mentioned a number and a wait list and such, but you know, these websites are pretty confusing. You have to really hunt for things. Is there specifically a number that we post somewhere for that? I mean, I know there is, but.
On the page that Carlin showed, there's actually two tabs. One that says how many Pickens County residents have been vaccinated. And that's because the governor said you can get vaccinated anywhere. So we know we have people at Valley View, or they might have been in Denver at Walgreens or somewhere. So there's the amount of Pickens County population that's been vaccinated, and then the number that we have vaccinated. So we're trying to get that out. It's a relatively new dashboard. We're also trying to figure out how do we equate the number of doses shipped, because when it's Pfizer, they say shipped, it's 975. But because we have pharmacists doing the draws into syringes, they're getting an extra dose out of every. So we have 1,170 shots being given from what they say is 975 doses. So there's some interesting math to try and illustrate. And we're on that website all the time to be able to have it make sense. But it is confusing, Brett. It's not exactly something where you can add the two together and it all makes sense.
Right.
Okay. Tori.
Thanks so much, Marky. I just want to take one moment and compliment and thank Phyllis, Carlin, Jordana. I know the comms team as well. I know a lot of people are working on the vaccination part of the response to this pandemic. As we all have known, the way that the tent is running and the vaccinations getting in arms has been running very well. And I just want to take a moment to compliment you on that work. But then again, the update that Carlin gave us today is really great communication. And I just want to thank you guys for the work that you're doing and compliment you on it. I only had 2 questions for Carlin today about vaccination, and she answered both of them before I had to ask them. So I want to just, again, my compliments to you. You guys have done a great job, and I think everybody in the community recognizes that. And so I just want to pass that on to you. Thank you.
Yeah. They're awesome, awesome team. Kim, you had your hand up.
Yeah, I just wanted to emphasize and encourage everybody to register for the vaccine. As Carlin had pointed out on the website, even if we're not in your subset at this moment, it's really important for everybody to register. And you will be identified when we get to that area, when we get down to the line where you qualify, even if you're in the general public. It's very important to register. And again, as I had shown earlier in the meeting, the data from AVH, which is so fascinating that we have this subset that we can look at in our community, almost 80% of AVH workers are vaccinated, and just a very sharp decline in the number of healthcare workers out. So we have to believe that the vaccine is working and want to use that data to encourage others to get it.
Thank you. Let's move on. Greg, go ahead. I'm sorry.
Marky, just wanted to tag on to what Tori said. I had a chance to stop by and look at the operation for the vaccinations this morning, and we see county staff out there. A lot of our local EMTs and emergency personnel from across the board are working this thing, and it's a well-oiled machine. It was so cool to see the Mayor John Peacock, greets people as they first go in, and then it's a whole parade of all the faces of the people who are making this happen. So it goes beyond just county and city volunteers, but to our local EMTs and medical workers are there doing it as well. And it's really fun to see. Thanks.
Okay, Patty.
Yeah, real quick, and you all need to know that we've actually been getting thank you notes from the public, something that elected officials don't often get, and that's been really appreciated. They're sending us their thanks for a job well done and how fun it is to go get a shot. So, and I'm not talking a shot of booze, I'm talking about a shot in the arm, and they're really enjoying it. So yeah, it's working out really well. So, and we want to thank everybody who's been involved in getting this out there.
Okay, thank you very much. We're going to move on. The next item on the agenda is a 5-star update. Raleigh.
Thanks, Marky. And I'm actually, sorry, I'm having some internet issues, so I'm going to keep my video off just so my computer doesn't have to work so hard. So firstly, I wanted to start off by letting you all know Brian Doherty, who has been managing the consumer protection team, will be moving back to his normal public health role in OWTS now that we're moving close to getting into spring and summer season. He does have to work on some permitting for houses. So Joanna Coffey, who's been working on the consumer protection team for quite some time, will be stepping into that managerial role for the consumer protection team. And therefore she'll be working very closely with the 5-star program. So we're very excited for these transitions. Now on to 5-star. So just a reminder, there's a little bit of a twist to CDPHE's new Dial 2.0 for counties in level yellow trying to implement the 5-star program like Pitkin County. So CDPHE is requiring that 5-star certified businesses may not operate in level blue restrictions until Colorado has vaccinated 70% of Coloradians age 70 plus. And that's with a minimum of 1 dose of the vaccine. So as our inspection team starts certifying businesses, our inspectors have really specific talking points about this requirement. So businesses know that it's more acting so like a pre-certification at this time until we reach that vaccine threshold at a state level. And then last I heard, we are about at 90% of that 70% vaccine threshold. So we just have about 10% left till we get to that state requirement. And, CDPHE did estimate that we could get there by the end of this month. But with the winter storms and, natural disaster in Texas, just letting you all know that it may be a little delayed depending on vaccine allocation. Next slide. Thank you. So we want to remind everyone about the the benefits of being five-star certified. So Dial 2.0 is designed to swiftly move counties into more restrictive levels when numbers go up and more quickly into recovery when numbers go down. And we understand that five-star capacity restrictions in lower levels, like Pickens County is in right now, might not apply to many businesses due to their smaller space and square footage. But if Pickens County were to ever move into more restrictive levels, then being five-star certified could definitely help increase capacity. Additionally, we want to stress that that being five-star certified means more than just increasing capacity limits. It means that the business has gone above and beyond the state and local public health orders in order to meet these certain requirements. And these extra steps can further protect the health of employees as well as patrons. So the window cling that the five-star businesses will display on their windows, which is to the right of the slide, represents and really acknowledges that the business is implementing extra steps to ensure the safety of everyone who walks through their doors. Next slide. So for some updates, the administrative committee voted yesterday to roll out the five-star program among all three sectors at the same time. So originally we were prioritizing restaurants to be the first sector to open at five-star capacities when eligible. But now we believe, we have somewhat of a small amount of applicants and businesses certified that we do believe that opening all three sectors at the same time will be safe. Therefore, once Colorado obviously has vaccinated that 70% of Coloradians age 70 and older, as well as that report card still in passing on all three metrics, then certified restaurants, gyms and fitness centers, and then personal services will all be advised that they can start operating at five-star capacities. Additionally, the administrative committee is having weekly conversations about how indoor events fit into five-star and when we should be opening up applications to indoor event facilities. So we will communicate out any updates when we know of them. Next slide. So here's some current numbers as of yesterday. We've received a total of 72 applications. 60 are from restaurants, 8 are from gyms and fitness centers, and 4 are from personal services. 28 inspections have been conducted, all of which are from restaurants, while the other 32 restaurant applicants will either be scheduled or will either be inspected later this week or next week, maybe have been reached out to schedule an inspection, or we're awaiting more information for that application. And as I mentioned, these businesses are going above and beyond to meet these five-star requirements. So we're just making sure that the application is thorough and complete before we move on to inspection. 6 gyms and fitness centers, as well as 1 personal service application are either in review or have been reached out to set up an inspection time. And then for the other small handful of those applications among those 2 other sectors, we're still awaiting more information for those applications just to make sure they're thorough enough. Next slide. Lastly, we're gathering communication and promotional needs upon inspections. So the inspection team are asking businesses, and this is fairly a new addition to the program, the inspectors are asking businesses about what they would want or need. So we will take their feedback and request to start creating some content for these businesses, whether it's signage about mask wearing, whether it's about what 5-star program means and where that signage can go around the restaurant or business itself. So we'll get creative with that. We will also be working with ACRA to start featuring 5-star businesses on a weekly basis for businesses who show interest. So I think I foresee that coming into play, especially when the program is fully rolled out. And then as far as the timeline goes in regards to the process of receiving applications through inspections, it's really dependent on the thoroughness of this application. If we don't request additional information from the applicant, we've seen that the application review process can really take as little as 48 hours. And then once approved by that administrative committee reviewer, then the consumer protection team immediately reaches out to schedule an inspection appointment. However, we also have been experiencing some outreach barriers, such as not hearing from applicants, and therefore we've been trying to follow up via email multiple times. I think moving forward, if our consumer protection team has the capacity, they'll be trying to do some in-person pop-ins as a friendly reminder to, get X, Y, and Z in order for us to inspect them and to just make sure they're getting 5-star certified if that's what they still want to do. And that's about it. I'm here for questions.
Thank you. Any questions for Raleigh?
I have a question related to Pickens County. How close are we to having 70% of our 17-year-olds vaccinated?
Carlin, yeah, that's a great question. I don't know if Carlin's still on here. I know we moved on from that 70+ age group to 65 and up. But Carlin might have better data on that. Sorry to put you on the spot, Carlin.
Sorry, what was the question about 70+?
About what percentage are we at? Are we at 100% of vaccinating our 70+ population here in Pickens County? Do we have those numbers?
We have gotten to everyone who is pre-registered in our system and is 70+. So everyone who has wanted it has had the opportunity thus far.
How many are in that population?
That information is also on the vaccine data dashboard. So you can look at in different age groups, how many people have been vaccinated in comparison to the population.
Then we could compare that to the US Census for 75 and older in Pickens County. Could you do that, please?
That's actually exactly what's on there, Tom, or Dr. Kurt, sorry. So when you go onto our vaccine dashboard, you'll see a dot for where the census estimates are, and then a bar graph for the percentage of that population or the count of that population towards that census number that's been populated. But let us know if you have other feedback or if it's hard to understand on there.
Do you know what % we are now?
I'm trying to load it up here. Give me just a second.
I'm thinking we might lobby with Governor Polis and CDPHE if we're above 70% to be 5-star as a county.
And I can definitely ask that at the state level. We haven't heard any changes in that policy decision, but I'm happy to get clarification as well.
Okay, while Suzuho looks that up, are there any other questions? If not, we're going to move to the next topic, which is BoH applications.
I wasn't sure if someone was going to share their screen or not, but the 70+ first doses are at 1,500, which I believe is over our census estimate for that population size. So
question for you, Suzuho, now that you brought that up. In our population, we have part-time homeowners also getting vaccinated in that population. We don't have an estimate of the total number of part-time homeowners in that 70 plus, do we? You're muted.
Thank you. Sorry. That's correct. So that's one of the complications with our dashboard. We have two kind of tabs when you go on there. One is for the number of Pitkin County residents who have been vaccinated, and then the other is for the number of vaccines that have been administered in Pitkin County. So that latter tab, which is the number administered in Pitkin County, may be for Pitkin County residents as well as second homeowners or others, now that the state has opened up vaccines to folks outside of our county of residence as well. So you kind of have to toggle between the two. And when we're giving estimates based on age and census, it's only for that tab where it's based on that denominator of Pitkin County residents.
Okay. Another question that I've received from some folks in our community was, if someone travels here from out of state, can they get a vaccine?
So Marky, so far the guidance that we're getting from the state is that we are not permitted to ask for any identification. And so if people are here and are going to be here for that second dose as well, that they are eligible to receive vaccine in our community. So we're continuing to do our best to make sure that we're doing outreach to our local residents, making sure that they understand how to register, but we are not requiring any kind of identification, which we recognize as a double-edged sword, right? So some folks might be able to get in, which might not be our intended population, but it's also protective for those who might not feel comfortable presenting identification, and for whom that would be a barrier to getting the vaccination. So the state has that policy with an eye towards being as equitable as possible in vaccine administration.
Thank you very much for that information. Let's move on to BoH Applications. Jordana.
Suzuho is going to walk us through these slides, actually.
This will be super quick. We just wanted to let everyone know that Board of Health applications are available on our website now. Some of you whose terms are ending probably got a call from Charlotte, or will be getting a call from Charlotte in the next week or two. But just a reminder, here's our current slate of Board of Health members. You can see whose terms are ending as of April 1st of this year. Because we're such a new board, everyone's only served at most one full term, and you have the opportunity to serve up to 2 terms. So everyone whose terms are up are eligible to run for another term if you so desire. If we go to the next slide, I just wanted to show us kind of talk us through how to get to the application in case there are any of you who want to submit an application, or any of the viewers as well. So first you'll go to our Pitkin County homepage, so just pitkincounty.com, and then on the I want to apply for citizen board drop down, you can click on that link, and then the next slide will show you the top of that page. There are 2 different forms, so I just want to point that out to everyone. There's the renewal application for any of you who are currently on the Board of Health wanting to apply to stay on the board, and then the citizen board application, which is the top link, which is for anyone in the community who has not been a part of the Board of Health who would like to apply. Both pools of applications will be reviewed simultaneously by the Board of County Commissioners, who is the decision-making body for making appointments to the Board of Health. So with either of those application forms, if we go to the next slide, the main thing you'll have to do is go to the drop-down menu and select Board of Health, and then you'll get a series of questions that you'll need to fill out from there. I think it's pretty straightforward, but we just wanted to point out these first few steps that are important to make sure that you're getting to the Board of Health application, since there's so many different boards that are recruiting right now. I just want to make sure you're filling out the correct application form. As we discussed a couple meetings ago, there's also an announcement in the daily news every Monday in the paper showing which boards have vacancies. And so the Board of Health will be listed in there over the next few weeks as well. If we go to the next slide, in regards to timelines, the applications are due April 2nd. So if you're interested in submitting an application, please be sure to get those completed in the next month and a half or so that we have left here by April 2nd. We will be scheduling interviews with applicants between March and April with the hopes that the BOCC will be able to finalize their decision and make appointments by April to start our next Board of Health kind of year with everyone on board at that point. If any of you have questions about the application process, feel free to reach out to Charlotte Anderson. And then if you have questions about the actual Board of Health experience or the position, the roles and responsibilities of the positions, things like that, you can reach out to Jordana as well. So that is the quick overview of next steps with application processes. But any questions around any of that? All right, thanks everyone. And just a reminder, we will have our elections on March, the first regular meeting for us, which will be March 11th. So that's when we'll nominate and vote on the chair and vice chair of the Board of Health as well, but that'll be a separate process done here.
Any questions? Yeah, Patty?
Why are we going to vote on chair and vice chair before we elect the board for the next year? Shouldn't we wait till after we have a new board seated to determine who's going to be chair and vice chair?
Yeah, so there's some, I think once we get through this pandemic, we might want to revisit our bylaws and see if there are some things that we want to change based on the way it's written right now. I think the original intent was that we wouldn't necessarily want a new person being a vice chair or chair of the Board of Health. We'd want someone who's has at least 1 year of experience, which is why it was written the way it was, but that's definitely up for discussion if we want to revisit our bylaws and change some things. I think now that we've been in existence for the last 3 years, there's some other things that we as staff would like to review with the board about just ways to improve the bylaws as well. So we can see if that's something maybe at this year's Board of Health retreat, we can review it together and make some changes there.
Okay, because it just doesn't make, I understand wanting somebody with experience, but it might be that you elect somebody to be chair and vice chair and they're not reappointed to the board. So then you're having to repeat the thing, but we'll just see how it goes and we can make changes as we feel necessary. But generally somebody who's new to the board doesn't want to be chair or vice chair. They want to get some experience under their belt, but we'll see how it goes. Thank you,
Patty. I think we realize that too. So we'll work through that.
Okay, Dave Ressler, good afternoon.
Good afternoon. I've been paying attention all along, kind of a voyeur. Wasn't on camera most of the time, but I just wanted to pass along that I am in a very unique position to be able to observe the work that's being done to protect our community from multiple vantage points. Like Tori and Patty, I'm on the chamber board, and then I work with public health, and of course I have my work with the hospital. And I want to just spread a little sunshine and tell you how impressive these partnerships are in this community. And I know they're not occurring anywhere near to this level in other communities. As I listen to other hospital administrators talk about the frustrations associated with trying to get this important work done. This community is truly amazing. And the partnership that Public Health, Jordana and her team have with Debbie Braun and the chamber and the business community is truly remarkable, as everybody gives and takes and tries to find the right balance between protecting the community and maintaining our economic thrivancy. And similarly with the hospital, our medical team, our docs, and our staff work hand in hand with public health and community health services in these partnerships. And that's why everything is really running well. And that's something that I think our community should be very proud of and appreciative of. They're working together. They're in good hands. So I just want to thank all of you for leading that and being part of the discussions and being so thoughtful in the work that you do. So thank you to all those on the call today.
Thank you, Dave, and thank you for all of your leadership. It's pretty phenomenal, everything you're involved in and the work of the hospital. So thank you so very much. So let's turn towards the next agenda item, which is round robin. And this is board member and alternates opportunity to talk about what they're hearing in the community. And then Tom was the first to put his hand up. So Tom, you're up.
I'm talking on a dual role because I'm also on the Wheeler board. And as you know, the Wheeler Opera House has just hired a new CEO, Linda Rigsby Peterson. And she is going to be interested because she's starting in March on what the Wheeler can do in opening performances and how that needs to be staggered in. So how can I facilitate that in a manner of how we should introduce Lisa to the community, and to whom in the public health staff should she be communicating with?
Hi, Tom. We can connect her with Tiffany, who's really working on our events and summer planning for upcoming events.
I've noticed that in Vail, that one of their concert auditoriums said that they can now accommodate 100 people under the new rules. Are we in the same situation?
Let me pull up our indoor event guidance under yellow level restrictions. That shows that we can, let's see, indoor seated events and entertainment can seat 50% of the occupancy up to 150 people with 6 feet distancing between parties. So it depends on the size and the layout of the space.
That's very helpful, including to Michael Goldberg. Okay, anyone else? Greg?
Yeah, if I could, just a couple of things. One is it sounds as if moving forward, we're going to public health is going to keep their eye on what's happening with all these variants that are emerging. And I just would love to understand how confident our public health department feels with the information they're getting regarding the emergence of all these variants, and also looking at the predictions of the way the curves seem to follow a pattern that's predictable in some cases. I don't know if you want to, it might be a dead horse already. Maybe you've covered that ad nauseum today. That was one of my questions. Another thing is also, I know we've had a lot of concern in the community that people have been really upset when we make changes. You know, we get letters saying, why do you change everything? The fact of the matter is, if we weren't changing to try to be adaptable, to try to make things work for the community, I think things could have been a lot worse. The alternative could have been much more stringent rules that were less changing. And I just wanted to, I was hoping someone else could either verify that or disagree with me. But I know to combat the frustration we have in the community, I think we've done our best to pivot as necessary to accommodate the changing needs and requirements of the virus as we learn about it. There was one other thing I wanted to bring up quickly, just regarding Dave Ressler's comment and the compliment he gave to this Board of Health and to our community for how we've responded following what's happening in the state. If you don't know, public health departments across the state, in some cases, are in complete disarray, where the public health directors and staffs have been literally chased out of town, or have been sabotaged by their board of commissioners. There have been some really terrible stories, and we could go into detail, but if you want to find out more, you can get a hold of us. But what has emerged is that I think people are using our structure here as a model, believe it or not, because we are so inclusive. We listen to the community, we listen to the elected officials, and I think this hybrid model for Board of Health, it's like democracy. It's kind of a mess, but it's the best thing we've got. And I just wanted to put it out there. So if anybody has questions or wants to know what's happening elsewhere, they'll be shocked to hear some of the horror stories about what's happened with the way that public health has been administered or received in communities that weren't receptive. So I wanted to thank Dave for saying that, and I wanted to make sure everyone knows that, yes, I think, it's not pretty, but we're doing the best we can. Thanks.
Thank you very much, Greg. And I think we all should be proud of our wonderful Pickett County Public Health Department, all of our partners and everyone on this board and all the community. And today, right now, we have 68 people are participating as attendees. So that's outside of those that I see on the Zoom call. So that speaks volumes of our community, who's very supportive and really want to be in the know as to what's going on. So anyone else on round robin? No, I don't see any hands going up. Our next meeting is going to be March 11th. And that will start at 1 to 3:30. Hey, Tori, you got a comment.
Yeah, I'm sorry. I was just looking back at my notes, and I guess I brought it up earlier. I guess I just want to say about the microgen backlog of cases. I guess, I do have concern from what Josh was saying that that we may be put in a position where these case reportings are going to push our level up. I think it was pointed out that with just the reporting that's going on today, it takes us to the upper end of the yellow parameters, 264 plus, or whatever that was. So I guess I did want to just bring up in this round that I'm concerned about that. If the reporting back from microgen is going to trigger us changing levels or not, am I understanding that correctly or no?
Yeah, I can answer that for you. So that's how the data will come through. I've been in communication with the state as soon as we learned about that backlog to let them know that might be coming, that we might get it all in a chunk. And while the numbers that are going to probably end up on the dashboard may not be able to be changed, the state's going to take that into consideration. If you remember the process for any time numbers, hit a different dial threshold, the first thing that happens is that consultation with the county to confirm the data, right? So if that were to happen, we would meet and say, well, this happened because it was a backlog. All the results came through on the same day. So let's go and try to figure out what the more accurate reflection of the truth is, and then go from there. So if we look through and there were enough cases that spread over the appropriate period of time would still bump us up, then we would proceed. But that is why that is a part of that system.
Thank you for that.
Okay, any other questions? If not, do I have a motion to adjourn?
So moved.
Thank you, Tom.
Second.
Thank you, Greg. All in support, raise your hand. Have a good week and a good weekend. Take care. Bye.
Thinking about you, Marky.